I'm Dr. Rachel Tate at ACR Convergence 2021, and today I wanted to share with you RheumNow's Team PSA Best of Abstracts for Monday, November 8th, 2021. So our first abstract tonight is number 1444 by Dr. Cherubini et al., which looked at patient baseline characteristics leading to nausea and alopecia in patients started on methotrexate. Now, there's a caveat to this. This is a study that was done in RA patients and in that particular population, but there's a number of rheumatologists, or there are a number of rheumatologists that use methotrexate in psoriatic disease. So we actually felt this was pretty appropriate for us to include in the PSA roundup. So there were nearly 1,100 patients that were included from the RAMS cohort study. Over 65% of these patients were female, a mean age of at medication start, and about 1/3 of patients reported nausea within the first year of methotrexate use, and alopecia was reported in 83 total patients. Women were more likely than men to report both nausea and alopecia. Alcohol use was associated with both nausea and alopecia, and the belief that you would develop any of these side effects show that there was an increased incidence. And interestingly, higher disease activity ultimately led to increased incidence of nausea. Now, I thought that this was possibly correlated with a higher dose of methotrexate. However, patients who were on concomitant methotrexate and another CS-DMARD were less likely overall to experience nausea. And interestingly, our older patients were less likely to report nausea, period. So this is a really interesting study, and I think it would be interesting also to see how you can utilize it in your discussions with your patients, and it may reshape the way that I discuss AEs with patients in regards to methotrexate. So abstract number 2 for us today is number 0182, and this was out of Austria and Canada, and this particular study explored joint tenderness, not synovitis, just tenderness, as it relates to radiographic progression in both rheumatoid arthritis and psoriatic arthritis. So there were over 2,200 RA joints and nearly 500 PSA joints that were evaluated by physical exam, by ultrasound, and of course by X-ray. And ultimately, the results showed that tenderness in non-swollen joints is not a major risk factor for subsequent radiographic progression in either rheumatoid arthritis or psoriatic disease. Interestingly, they believe that tenderness may actually be an indicator of structural damage rather than current inflammation, which I know is something we've seen before in abstracts at ACR and actually EULAR as well. Now, also, Power Doppler showed a higher association with radiographic progression than tenderness did, with the exception of early PSA patients. So this may be another modality that you want to consider for your psoriatic arthritis patients. Hopefully a little novel thing that you can keep handy in clinical practice. So make sure that you continue to watch our ACR Convergence 2021 coverage on rheumnow.com.